I'm Lynn Branch, and I'm the Client Commitments Director at ClearScript, and I'm thrilled to have you with us today. Today, we're unpacking the negative buzz around big PBMs and some of the questionable business practices that we've been hearing about. We're also going to explore how ClearScript advocates for a shift in priorities to ensure that patient care comes first, not profits. And our guest speaker today is someone who really understands the importance of patient care in pharmacy. ClearScript President Brad Scudder isn't just a leader in our industry. He's a seasoned pharmacist with nearly 40 years of experience, 30 of those years in pharmacy benefit management. His extensive knowledge of the PBM industry and his visionary leadership have been instrumental in guiding ClearScript's strategic direction for the past 11 years. Brad deeply values patient care delivery and is dedicated to balancing positive patient outcomes with managing the rising costs of care within the PBM space. Welcome, Brad.
Thank you for the kind introduction. I'm happy to be here, but suddenly feeling very old.
Brad, there's been a lot of scrutiny in the media and among regulators recently about pharmacy benefit managers and some of their business practices. The big three in particular, CVS Caremark, OptumRx, and Express Scripts, are drawing a lot of attention for putting profits over patients. Can you tell our audience what that means and how ClearScript is different?
Sure, that's a great question. It means that some PBMs engage in pricing strategies for their own financial gain or shareholders or private equity owners, often to the detriment of patient care and the plan's fiduciary responsibility. ClearScript is clearly different. We are owned by Fairview Health System, a nonprofit, mission-driven organization with patient-first values and a clear commitment to high-quality patient care and fiduciary stewardship. As a pharmacist, I believe that integrating the pharmacy benefit into patient care results in a better experience for members while helping to manage healthcare costs. ClearScript, as a business unit of Fairview Pharmacy Services, is fully integrated within Fairview Health System. That's important because it means we bring a holistic approach to our clients and their members. It also means we have access to healthcare experts across the entire system who can offer firsthand insight and expertise in bringing solutions to the pharmacy benefit. With a front row to patient care across a wide range of services, including specialty, home infusion, compounding, mail service, retail pharmacies, MTM, and I could go on, our partners at Fairview Pharmacy Services bring a wealth of expertise and experience. They help us bring a level of care and cost-saving solutions that go above and beyond any other PBM.
Yes, being a part of a nonprofit health system definitely gives us a patient-first perspective. We're also hearing a lot of talk about transparency. It's not a new concept, but it's getting a lot of buzz now. What do they mean by transparency in PBM contracting, and why is it in the news now?
Yes, this is a hot topic right now. Transparency in PBM contracting refers to the disclosure and clarity in conducting the PBM's business, particularly regarding pricing, fees, and rebate arrangements. This issue is getting a lot of attention from the FTC and the media because the big PBMs have very murky business practices. Those PBMs use opaque pricing and contracting strategies that make it very difficult for their clients to understand the true cost of drugs and the profits their PBM is making. Unfortunately, that lack of transparency has been around for a long time. That is why Fairview started ClearScript back in 2005. At that time, Fairview was using one of the big PBMs for their own employee plan. They were in a unique position to learn what the PBM was paying their Fairview pharmacies, which was much less than what they were charging the employee plan, which was your traditional spread pricing. Fairview knew that they could do better, so they created ClearScript as a pass-through PBM to serve their plan and other employer groups who could benefit from the same transparency and patient-centric care. Nearly 20 years later, we still don't engage in spread pricing, and we continue to offer the same level of transparency and pass-through pricing to our clients as we demanded back in 2005.
Right, that transparency is so important. What can organizations do to make sure they are getting transparency in the pharmacy benefit?
This is an extremely important question. And the key is understanding your contract. A transparent PBM will disclose how they set prices for medications, ensuring the client understands the cost without hidden fees or markups. They are clear about how manufacturer rebates are handled and whether they pass rebates directly to the client. Transparent contracts also include unrestricted audit rights, allowing clients to verify that they are being charged correctly and receiving all due rebates. At ClearScript, we are pass-through and fully transparent in our contracts. We don't have hidden fees or markups, so our clients know exactly what their drug costs are. We provide monthly claim level reporting so clients know what discounts and rebates are received on a drug-by-drug basis every month. No other PBM pays monthly rebates and provides claim level details as far as we know. Our contracts are also fully auditable, allowing clients to hold us accountable and confident in our fiduciary stewardship. This level of transparency offers our clients a degree of trust that most of our PBM competitors cannot provide.
And I know our clients appreciate our level of transparency as well. Another criticism of PBMs is that they place tight restrictions on their clients to steer their members to the PBM's pharmacy. Why do they do it, and why does it matter?
It's all about money. Some PBMs set higher reimbursement rates through their own pharmacies. That's why they often restrict their clients' prescription fulfillment to their own PBM, owned pharmacies. These misaligned incentives allow the PBM to maximize profits even when it may not be in the client's best interest. ClearScript takes a more balanced approach. For example, we have a health system and tribal clients who operate their own pharmacies and have business strategies focused on improving pharmacy growth and revenue. Not only does ClearScript support them in designing their employee benefits to maximize internal fulfillment, but we also provide consultation on best practices and business strategies from our health system experience to help them grow their pharmacy business. Here are a couple examples. We have helped one of our long-term clients increase their internal capture rate by over 600% over the 7 years they have been a customer of ours. That has yielded the organization over $142 million in aggregate revenue. In another instance, we've supported a hospital client who has been able to sustain an internal capture rate of 95%. Not all PBMs are willing to offer that type of support, like ClearScript.
Yes, that's different from some PBMs. But what about managing costs for the plan and the member? Some say that the big three drive up costs by promoting more expensive therapies. We know that ClearScript drives to lowest net cost for our clients and the most affordable therapy options for their members. How's this different from other PBMs?
Yes, this is important for clients to understand. ClearScript is successful when we help our clients lower the cost of care. That means ensuring members have the medications they need for the best outcomes and using the most affordable therapy. We are able to accomplish this in a few different ways. First, our formulary is designed to balance clinical effectiveness with cost. Drugs are placed on preferred tiers when they offer the best clinical and cost value. This enables members to access safe and clinically effective medications at the most affordable price. Second, we make sure the member pays the least amount possible for their medication at the pharmacy. ClearScript always uses lesser of logic when processing claims. What that means is the system will compare many variables to determine what is the lowest cost. Is it the pharmacy's cash price? Is it the pharmacy's discount? Is it the maximum allowable cost? Or is it the copay? End of the day, it's the lowest price that will be charged to the member and the plan. Third, we support members in finding the lowest cost channel to fill their prescriptions. Many people don't understand that drug prices vary from pharmacy to pharmacy, sometimes by a significant amount. We offer members we serve an online secure portal and a mobile app that enables them to easily find where they can get their medication for the lowest cost. These and other ClearScript programs and services help members save on out-of-pocket expenses, as well as reduce the overall cost of prescription drugs, benefiting both clients and their members.
Well, lower cost drugs are definitely a win-win for all parties. And people often think bigger is better. How does ClearScript compare to the big three in lowest net cost?
Yes, that is a question that we get asked a lot. There is a lot that differentiates ClearScript from our largest competitors. When it comes to cost, there can be a huge difference between PBMs. For example, a recent New York Times article referenced 3 oncology drugs where pricing was a concern. The paper quoted the prices of the drugs at CVS and Express Scripts. Our analysis of the same drug showed plan savings of 88 to 94% for one drug and 96% savings for another at ClearScript. When you are comparing a drug that costs $2,000 per month at one of the big PBMs to $79 per month at ClearScript, that's a big difference. And clearly somebody is making a lot of money in profits if that's the case.
That's true. Many people are surprised at the vast differences in cost. So last question. There's been some discussion and litigation around plan sponsors' fiduciary responsibilities to their employee health plan. What does that mean for PBMs?
Fiduciary is a fancy legal term that means the employer or your plan sponsor is making business decisions that are in the best interest of the plan and the members they serve. When plans align with for-profit PBMs with opaque business practices, they cannot be confident whose best interests are being served by that relationship. PBMs with transparent business practices like ClearScript, we allow employers and plan sponsors to have better oversight of their benefit, and we serve as fiduciary stewards. They can monitor and audit the plan's activities, and that allows them to confirm and confidently report that the PBM is supporting their fiduciary responsibility.
Yes, that's extremely important in today's environment. Well, thank you, Brad. You've shared a lot of great information about the current PBM landscape and how ClearScript is different. I think our listeners will find this candid conversation very helpful. To our listeners, we thank you for joining today's Coffee with ClearScript. If you have any questions or want to find out how we can help your organization, please reach out to us through our website at clearscript.org. Have a wonderful day.